Type 2 diabetes accounts for 95% of all cases. Managing it often feels like signing up for a lifetime of bland, restrictive meals. But we can fix that. We are going to build a practical, delicious daily meal plan using 6 specific foods proven to lower blood sugar and support heart health. Grab a pen and paper. You will want to write out this grocery list alongside these steps. Keep in mind, dietary control is a long-term strategy. It requires consistent, daily habits rather than overnight miracles. By shifting away from a mindset of restriction and focusing on a proactive, ingredient-based plan, you gain daily, sustainable control over both your blood sugar and cardiovascular health. Let's start the morning routine. At the top of your list, write down oats and unsweetened Greek yogurt. Oats contain a soluble fiber called beta-glucan. This graph shows what beta-glucan actually does. It flattens your post-meal glucose and insulin curve as it absorbs. In clinical reviews, eating oats regularly lowers fasting blood glucose, while simultaneously pulling down your LDL or bad cholesterol. Pairing those oats with unsweetened Greek yogurt adds dairy proteins and live probiotics. These components work together to boost your insulin response and improve your overall glycemic status. For practical meal prep, you can blend plain oats, Greek yogurt, and low-fat milk into a quick breakfast smoothie. Or just make a standard bowl of oatmeal and top it with a scoop of the yogurt. You must read the labels at the store, however. Flavored yogurts and instant oatmeal packets often hide massive amounts of added sugars. Getting this specific fiber and protein combination right prevents morning glucose spikes, setting a stable metabolic baseline for the remainder of your day. Moving to the middle of the day, replace sugary snacks by adding blueberries and prunes to your list. This chart shows data from a 2020 trial. Men with diabetes ate 1 cup of blueberries daily. After 8 weeks, their A1C levels noticeably dropped. Alongside the A1C drop, that daily cup of blueberries also lowered their triglyceride levels, offering a secondary boost to heart health. Prunes offer a different mechanic. Their dense fiber content and low glycemic index physically slow down digestion. This prevents sudden sugar spikes and keeps you feeling full longer. By leveraging these specific whole fruits, you can satisfy a sweet craving while keeping your blood sugar strictly stabilized. To complete the midday snack profile, you need to bring in healthy dietary fats. That means adding walnuts. Consuming just 2 ounces of walnuts daily improves endothelial function. As we see in this blood vessel cross-section, that means the vessel walls actually relax, allowing blood to flow unimpeded. You can easily combine these walnuts with your prunes to make a homemade trail mix, or you can crush them into walnut butter to top a slice of toast. Directly improving vascular health with healthy fats addresses the severe cardiovascular risks inherent in managing type 2 diabetes over the long term. For the evening meal, the American Heart Association recommends eating non-fried oily fish twice a week. We are going to use salmon. Salmon delivers a high concentration of heart-protecting omega-3 fatty acids, along with premium protein. To see why this matters, look at this 25-year trendline graph. It shows a clear divergence in cardiovascular risk. Regular consumers of oily fish sustain much lower rates of high blood pressure and abnormal cholesterol over decades. In women with diabetes specifically, higher fish consumption directly correlates to a reduced risk of sudden cardiac death. For a comprehensive dinner prep, take a salmon fillet, coat it with some crushed walnuts from your snack list, and bake it alongside fresh vegetables. Ending the day with an omega-3 rich protein secures overnight cardiovascular protection and finishes out the strict nutritional requirements of your plan. Here is your final output. You have moved from a blank piece of paper to a highly structured day of eating. The daily flow is set. An oat and yogurt smoothie for breakfast, a blueberry, walnut, and prune snack box for midday, and a walnut-crusted salmon for dinner. Taking this specific grocery list to the store translates the abstract goal of getting healthy into a tangible, executable action plan. Commit to consistency by testing this exact menu for the next week. And if you have your own favorite way to prepare salmon or oats, share your method in the comments below. This single day's menu is the blueprint for a lifelong habit. When planned correctly, your everyday meals become your primary tool for disease management.